health is the foundation that keeps communities healthy, productive, and safe. Unlike clinical care, which focus on treating individuals, public health focus on protecting populations. So public health focus on population, not an individual. It prevents treating, over-treating, and we focus on community well-being as a whole. So let's break it down into 4 key components or areas of public health. So when we say public health, what exactly goes into it? It is screening, health promotion, disease, and what? Advocacy. So we'll take it one by one. Screening. Early detection of diseases before symptoms appear. So the ability for us to screen, let's say in an example, blood pressure checks, screening or testing, cervical cancer, and then let me add so that the gender by men look at say that is in a check process. What role would a volunteer play in this area? Volunteers often serve as a link in the health facility and the community, mobilizing for assisting with and educating clients on the importance of early detections. So over here, in the past, as volunteers usually might not be, because there are some volunteers who may be also very, let's say, medically inclined, okay? But from where I come from, mostly you find people who may not be so on top of that one, but there are. So usually they do this registration, mobilizing of people, assisting in registration, and all other ones. Now let's look at what happens under health promotion, which is also another key component of health promotion. Public health. Please, sorry, just give me a minute, please. Okay, so sorry. So under public health promotion, this includes activities that encourages a healthy lifestyle. It could be in a nutrition education, exercise campaign, sanitation awareness, and more other things that could promote individuals' health. So that is what is captured under health promotion. So when we talk of health promotion as a volunteer, what is your role? What exactly do you do? Volunteers play this role by health messaging, by giving message in the communities. They are more effective because they are trusted by the community members. Usually, if the community volunteer or the volunteer is coming from the same community, they know themselves already. So they are trusted, and then whatever that they give or the message that they give out, people tend to believe and then use it. Now let's go to the third one, which is disease prevention. This includes immunization, mosquito net distribution, environmental hygiene campaigns, and preventive medication programs. As a volunteer, you help by mobilizing households, distributing logistics such as the mosquito nets or could be mosquito repellent that usually is applied on the skin, or by reinforcing preventive behaviors. So sometimes you could be educating people on how to even avoid mosquito bites. There are people who have all the means to prevent mosquito bites in their homes, but for one reason or the other, they unduly stay outside and they have the mosquito bite before they get into their homes. So some of these things could be one of the education that somebody can give when it comes to disease prevention. Now, advocacy. When you go to advocacy under public health, it requires that we speak up, advocating for better resources, improved sanitation, clean water, and accessible services. So here, you may not be talking for yourself, but you talk on behalf of community. You become the mouthpiece of that community. So you look around and find out that probably they have no even good drinking water. You could start advocating in either the municipal assemblies, people who are responsible for all those actions, by bringing to bear the problems that are existing in the community, and seek for their support to make sure that those people within those communities get access to those ones, especially if it's water, they can dig a borehole. If there is no hospital at all, you can have this cheap compound running where you can have a community health nurse who can manage minor ailments, and then in case it goes beyond the person's boundaries, she can then refer. So that is also under advocacy. Now let's go on and look at the critical importance of volunteers when it comes to why do they matter. Public health. This is what public health. They contribute in ways that professionals alone cannot. There are times you go to a community, you are new. Sometimes you don't even know your people. In fact, when I was preparing these slides, I was asking myself so many questions. And one of the main questions I asked myself is, who are my audience? Because as you prepare these slides, you should be able to meet certain standards if you know your audience. So I'm just hoping that whatever that I have here is adequate and enough to bring some understanding and clarity to the main thing we are discussing today. So going back to this, what we are saying is volunteers are the heartbeats of what? Public health. They contribute in ways that professionals alone cannot do it. You are given in, you have a lot of people coming for it. However, there are, you cannot go stop doing the injections of vaccines and go for more. You need some support. This is where they come in. Community outreach, volunteers, the reach health service into schools, churches, and market, communicate in local language and cultural context. This is very, very, very important because they know the do's and don'ts, some things that are acceptable to them, those are that not acceptable to them. So they are able to meet certain standards, and it is acceptable. Now let's look at areas where volunteers can be found when it comes to public health. We have the maternal and child health promotion, data support, and then we have community mobilization, which I just mentioned. Jenna, please go. Yes. So when you take maternal health support as a volunteer, helping mothers understand ANC schedule is one of your core responsibilities. Sometimes you realize that mothers will even forget that they are supposed to go for clinic, busy with certain things. So one of the things you do is to find a way of reminding them. Supporting child welfare clinics by mobilizing them, finding defaulters, making sure that they come for the clinic. Encouraging facility-based delivery when you notice that there are pregnant women within your woman, I say own because at that moment it should be one of your target focus, where we make sure that the person would be going to the clinic or the ANC, and when it is time for delivery, the person also goes to the facility where he can have skilled delivery done. Then also help tracking immunization before this, which I already mentioned under child welfare support. If you are a volunteer within the community, one of the ways you can improve maternal and child health is by mobilizing the defaulted to make sure that their children will get the shot that is required. Now, under health promotion activities, you have sanitation campaigns. So once you live within the communities, if there are no dustbins, people are dropping refuse, either dumping them in gutters or unapproved places. One of the key issues you do is to ensure that you educate them on how to properly dispose their refuse. Sanitation campaigns. There are people who may be defecating indiscriminately. One of the key things you can also do is the education towards proper sanitation. Then we can look at nutrition also. Here, to the extent that people can even gather at a deba, demonstrate even what one has to use to prepare certain kind of food, so that the food could be balanced diet. There are places you find people, all they need is to get carbohydrate, gari. In our here, Ghana here, we'll say you get gari plus your pepper and that is it. But if you are to bring them closer and educate them, yes, it could be still the gari and pepper, but you could also advise that you can add some slight onion, maybe green pepper here and there, so that we can push in this vegetable aspect into it. At the end of the day, it's still gari, but the person has some vegetables to add to, and some protein. It may not be meat, but beans, somehow, so that the person will get a balanced diet. School health also one of the things we also do. So health, you have oral care, medicine, you can also in some of the schools to make sure the children knows how to obtaining good oral care, and to my sisters and within the education, sometimes personal times, and so if you have the opportunity to educate in the schools, it's actually also supported by tutors. It helps a lot. So let's move on to data collection. So as a volunteer, when there is a program or there is any kind of that is being done over there, in case you don't follow the expert column, one is you can help with is registration during outreach or during that program that is being undertaken. We have recording of basic details. It could be name, or if the program requires that we don't use names, you assign certain codes to those people. Then if it is vital signs, height, weight, BMI, and all those things, yes, you help in that aspect. So you can help in that aspect. Then recording basic details, that is what I just mentioned. Then tracing community members. Yes, there are times, yes, whilst the program is going on, sometimes you realize that no, what you are expecting or the numbers you are expecting, you are not getting. It is one of your responsibilities, which once you stay within the community, you know what to say for them to really understand exactly what you mean. So you can go around, make sure you mobilize them to come in for that program. Helping verifying health service coverage. Sometimes we do a lot, but we are not able to get the figures. So one of the responsibilities or one of the roles you can help with is helping verifying health service coverage. Now we have move on to community mobilization. This is one of the most powerful contributions we get from volunteers. One of the powerful contributions, getting people to attend programs, debates and what? Screenings. That single volunteer mobilizing one household can save a life. So that is why when I saw this, every contribution matters, I was really enthused, very, very happy with it, because no matter how small you think your contribution is, it makes impact when it comes to what? Public health. It saves lives. Now, let's look at communication that you need to acquire or you need to have as a volunteer. There should be some level of understanding of how to communicate with the people that you want to either, should I say, convince or persuade to undertake certain changes in what? Their lifestyle or activities. So to be effective, volunteers must communicate clearly. So as a volunteer, your communication should come clear, respectful. You should be respectfully. It should be done what? Respectfully. And you as a public health or volunteer, you should be confident. I tell you, a lot of people read meaning into your posture. So it is not just what you are saying that they are listening or they are taking. They are reading meaning into every guest. So if you are not confident, sometimes they are like, oh, I actually believe this, what she is saying. But if you are confident, it gives them hope. Okay, so that is also another thing we need to look at. Communicating with different age groups, you should understand what to say, how to say it when you are dealing with different age groups. If it's a child, you have to use what? Simple message and what? Visuals. It should be what? Simple message and what? Visuals. When you are dealing with adolescents, you leave it open so that the person can flow to say whatever the person wants to say. You should be friendly and non-judgmental. If, let's say, I come to you and probably you are a reproductive health, then I have maybe you talk all this way. And then you ask questions. And maybe next week. The moment I make sexual partners with you, by just making an attempt to answer your question, maybe your facial expression alone is telling me, if I tell you the truth, you're going to judge me. What do you think will happen? No, definitely telling me not to tell you the truth. So when we are communication with people or we are discussing things, they are reading gestures, and if they notice that you are being judgmental, you will get answers, but it will be the true reflection of what probably they want to get. So as a volunteer, if you are dealing with a person, encourage the person to talk more, be friendly, and then above all, don't be what? Judgmental. Similarly, if you are talking with you have to provide the facts. Tell them the truth, the facts in their face, and give them practical advice. So if it is a no-no, be blunt and let the person go. And when you are dealing with adults, older persons, you would have to speak your communication, your words have to be what? How they go. People to be able to really understand your words. And you should be calm. She might not even hear exactly what you were saying, or will not even hear anything that you say. So you have to be calm and be patient. There are times you speak, you say all that you want to say, but by the time you are done, then you will ask again, please, what exactly were you saying? So you have to be patient when they are what? Older persons. I can see a hand up, and I also noticed that somebody was asking if there's going to be time for questioning. Yes, I think that the first time, my first lot was about 30 minutes, which I don't know whether I'll probably take the question whilst we present the last part of it, which is just a few more slides. So if there are questions, we can pause and take the questions before we proceed. Thank you.
Thank you, Mrs. Fatima, for those insights. If there's any questions?
Yes. Good evening, everyone. Thank you once again for giving me the opportunity to participate in this program. Once again, I remain my humble self, Queen. Concerning the trust issue that Mrs. Fatima said, how do you, when, like, going for a mobilization in a different local government entirely, and you're not from that particular state, you don't even know how they operate, how things are, how do you tend to gain their trust for them to open up and tell you this is what they are lacking? And also my second question goes like this. We said in trying to, like now, this working with age group, he said, adolescents, I know of how I was once in a foundation where the adolescents were not open because they tend to give them a fake promise and they don't open up again. So being and open very rare, they won't even accept open up to you and tell you what their problem is. At that point, how do you also control or handle the situation? That's my question, ma'am.
Okay. So thank you very much for your question, Queen. I think that this is open to all of us. I don't think it's probably me. If anybody is here and the person also can give input, you can also support. But to start with your first question, when you find yourself in a community you don't know or they don't know you, what you should do. There is something we call community entry. So you get to a community, you try to find either here I would say that either a chief or somebody significant, okay, within the community, to explain to the person what brought you there. Let the person understand everything so that that person will rather lead you to those people. Once they trust that person who is coming with you, it is not so difficult for them also not to trust you or not to accept you. So that is one of the things that you can do. For other programs, I have seen people going to reside even within certain community for some time before bringing up whatever program they intend to bring, just to familiarize themselves with their community members, for them to get to know who they are, and then once they bring up the whether proposal or whatever that they were trying to bring up, people will identify with it because the person has been part of them. Okay, so that is for the first one. The second one, when it comes to adolescents and trust, I think that as a volunteer or as a public health worker, one of the key need is trust. If you are not able to earn their trust, then you are doomed, because they will never trust you again. And as you said, they will not open up to you. So don't go promising them anything you cannot do. No matter how sweet you think you want to make them feel, or good you would want to make them feel, don't go promising them anything you cannot do. If whatever that you want to tell them doesn't rely on you or doesn't depend on you to provide, be careful with what you say or how you say it, because it will come back biting you. If you depend on somebody, let them understand that yes, you need that, I am taking notes. Please, I will also go and make sure that I will push for it or I'll ask for it. I will go and work on it. If you are not achieving it or you are not getting it, go back to them. Let them know that yes, whatever that you requested of me, I have started working on them. However, these are the challenges I am facing. At that moment, they will not feel disappointed because you are giving them feedback. Feedback is very, very essential when it comes to public health, or let me say, when it comes to even our own human relations. It's important. So I don't know whether with this I'm able to either answer your question or probably confuse you or convince you. Queen, are you okay?
Yes, ma'am. Yes, I'm very okay. Thank you very much.
You're most welcome. You're most welcome. Any other question?
Okay, good evening, everyone. My name.
Good evening, patients.
Patients at home. I have just one very simple straightforward question. In cases where these patients are being hostile towards the religion, and just because they're not comfortable, they want you to feel uncomfortable. I'm trying to talk to yourself and you. Please, did you get my question?
I don't know whether anybody really. No, patience, I didn't.
Okay, let me.
Did anybody hear what she said?
I can say it again. I said
Please come again.
Okay. In cases where the patients are being hostile and condescending towards us for no reason, like they're trying to be lively and be polite, just to make them feel comfortable, but still yet they don't want to open up, not really open up, they just want to be nice to you. They are being hostile back to back. What do you advise that we do in such cases?
Oh, okay. So this is, I think the question is about if the person is being hostile. Yes, you see, there are so many approaches that can be used. One of it is probably if you are more than one, you make another person try to see if the person would achieve the aim or the person can win that person's trust. There are people, no matter what you do, you cannot win them, or you cannot earn their confidence, or should I say trust. So sometimes it's good to let it be and then allow another person to try. That is if you have that, luxury, if you have other person with you. If not, you would have to try again, probably the approach you used. And sometimes it's good to give the person some break. Give the person a break. It is not about this morning you said you started asking questions and she's being hostile. In the afternoon you try to find her again. In the night you go looking for her. She will just ask, what is this? What do you actually need from me? So sometimes it is okay to let them be for some time. Though they were being hostile, it doesn't mean that they didn't listen or they didn't hear what you were saying. They heard it. So as they go, you give them the breathing space. Sometimes they will be reflecting on their own attitude and how they treated you. You don't have to feel bad about how they treated you by you showing it either through your words or your facial expressions. They will notice. Just become and be friendly. Say what you need to say and just let them be. Sometimes you will be there and they will rather come back to you when you try to see as if you've ignored them. There are times once you are moving around, the person has seen you. She was thinking probably you will go back to her. But you ignoring her will make her feel, so this woman that were pestering me today, she is not minding me. What is it? Maybe I'm the one who actually need her. Let me go and find her. But there are people too who will never come to you and you would have to still find a way and go back. But at least at that time, you've given the person some time to think about all that you said. Then you start thinking about the strategy. How did you approach the person? Even the place that you were discussing the issue. Was the place safe? Is it okay for the person? When I say safe, could it be that people were just passing by? Could it be that it was their background? I quite remember in one of my encounter with an adolescent, she came trying to talk to me, only for her to realize that her auntie also came to the same place. So she was restless and was just trying to find a way to run away. I didn't know her from anywhere. How would I know that it's the auntie who was coming? I didn't know. So I asked her, are there any back door? Then I realized that yes, probably she has seen somebody. So I had to help her to hide. Okay. Then when after giving her to hide, later I asked her, can we continue? She said, no. I said, no problem, go home. Are we meeting again? He said, maybe tomorrow or the next day. I said, okay, no problem. You call me when you think you want to have a talk. He said, okay. She never called. So I was there and said, okay, let me also try and see if I can reach. I called her and she said, auntie, as for that place today, I don't think it will help me. Can we meet somewhere else? You see, so she wasn't so comfortable where I wanted to meet her. So if you are dealing with adolescents, you have to be cautious of the environment you are discussing issues with them. Everything means something to them. I hope this is clear. Patience, are you okay?
Yes, I am. Thank you very much.
All right, thank you. Is there any other question, or we can proceed with a few slides that is left? Can we proceed?
Okay, I will humbly hand over to Mrs. Fatima to resume the second section. Thank you.
Thank you. So this will be the continuation from the communication skills that community or volunteers should possess. So we are done with how they have to deal with different age groups. Then we'll move on to cultural sensitivity. This is very, very, very key. People make decisions, or their health decisions are actually influenced by what? Their beliefs. You can see a child who is having diarrhea and is getting weaker, but to the old woman there, she believes that it is somebody somewhere who is what? Eyeing her with an evil eye or spirit. Such a woman, how are you going to get her to the hospital? So culturally, you have to be culturally sensitive. If you are going to discuss anything with them, take your time and know what to say, what not to say. Volunteers must approach community with respect, avoid judgment, understanding thoughts. Sometimes even how you dress alone will push somebody away. Because to them, they think that it is a disrespect for you to wear certain dress, or for you to dress in a certain way. The way they greet each other. When you go there, you were trying to shake hands. These are things that would help. You have to use appropriate language for them to really buy or understand exactly what you mean. Understand their norms, and you have to avoid criticism. Don't criticize them. They may be doing, as I said, don't go forcing them to believe what you think it is. Let's say you knew that, this woman is or the child is having malaria. She is also good that no, it is not malaria. It is an evil eye somebody is casting onto my daughter. Don't go confirming that yes, it is an evil eye. But don't go also saying that it's not that evil eye. Just try to push your agenda to get the child either to the hospital or to seek treatment. That is your goal. But trying to tell them what they believe is not it, you will not go anywhere. So we'll move on to building trust. So as a volunteer, you should be able to build trust among your member or community members. To us, trust is our currency in public health. If you have trust, you are rich. Let me put it that way. You are rich because at the end of the day, you meet your goals. Because at that moment, whatever you say, they believe in it. There are no doubts, there are no questions. Nobody will tell you no. Even if there are questions, they would rather seeking for clarification. So volunteers, or as a volunteer, you build trust through consistency, honesty, and then confidentiality. Very, very, very important, confidentiality. Today, you come and then I open up to you. I was able to tell you, I have this is my situation. Nobody knows it apart from you. Then the next day, as she moves around, people will start pointing fingers and start telling others. You may think that you are telling your close friend, but my dear, that your close friend also has a close friend. And that close friend also has another close friend. And before you could say that, somebody's confidential either health condition or problem is in the entire community, because people are what spreading it either knowingly or what unknowingly. So if people tell you, there are times they test you, even sometimes these young ones, they will test you with certain things and see whether you go and tell somebody. In fact, the first time they will not tell you the truth. They will tell you something that is strange. And then they will start nosing around to see whether those things they told you told somebody. If they get to know that, no, really you didn't say anything to anybody, the next time, that is when they will start telling you exactly what they need or what is wrong with them. There was a woman or young lady who had multiple partners, sexual partners. And amongst them, one was also a lady. So it means that she was having an affair with a man, and again, she also have a girl that she also what? That's whatever she want to do with her. When she came, she was giving me that scenario as a friend has it, and she's the one what coming to seek help for the person. After everything, telling me all that and me giving her the advice on what to do, bringing the friend and whatever, then she started moving around my own close circles to see whether I have started saying the things she told me. Oh, have you seen Auntie Fati today? Oh, okay. Me, I've been looking for her crowd. I haven't seen her. And then she will be like, oh, you go to your workplace. Don't you have a number? I said, no, I've been calling her, but it doesn't go through. Oh, okay. Then she passes. She did that for almost a week, just nosing around to see whether whatever she told me, I have started talking about it. Then after some time, she came back and she said, Auntie, say yes. The thing I told you is not my friend, it's me. I said, oh, okay. So you were the one. I said, yes. I said, that's fine. Let's see how best we can support you. Then she's like, oh, so you will not say it about it. I don't think you are happy about it now, or? And she said, no. In fact, I want to get out of there. Say, yes, that is my goal, to get you out. She started it to say them asking me questions. Me, won't you say that I am Christian or I am not a good Muslim? No, that is not for me to say. It's to find help for you. Sometimes they will rather be testing you. So let's be cautious about that. The more trusted a volunteer is, the more influential community. If people trust you, it's easy for you to what? Make impact. Now let's look at some case studies. Community outreach. In the rural community clinic, volunteers supported hypertension program. Over 2 days, they had more than 300 community members, leading to early development, thousands of what? A community health outreach. Because we have volunteers in community, they be in clinic there every day. But we want to do this. There were volunteers. They were able to do trade work for 2 days, and afterward, able to work 300 days, and they were able to early detect hypertension, and those who treatment also received the treatment, or they were referred wherever they needed to. with what? School health. Volunteers partner with health organize development menstrual education in school. Because volunteers were already insiders, listen to this one very carefully. They were insiders. Students encouraged more, students engaged more what? Freely. And attendance was significantly. So we were doing this community school health development and everything almost every time. But the patronage was low. They have a lot of ideas why they think we are giving them these developments. The younger of them, you could tell clearly this lady should be menstruating. She tell you, no, I am not part. I have not started menstruating. So what we did was to find individuals within that same school for them to serve as volunteers for us. So when we had only 2 health workers and we used 8 volunteers, it was a successful program than all that we were doing. So because we were able to get what students themselves to do what volunteers, it encouraged a lot of students to join the program. The attendance was increased more than what that we were doing all those things. Then the last one I want to talk about will be the immunization before test phase. A team of volunteers helped trace children who missed their measles, rubella dose. At the end of the program, coverage increased from 76% to 93%, which is very, very, very significant. These examples reminds us that public health succeeds when communities are what? Involved. Public health succeeds when communities are what? Involved. All right, let's look at some practical steps for volunteers. Reporting is one of the key roles of what? A volunteer. You would have to report activities that are completed. Let's say you lined up certain things you needed to do for the first quarter. You should be able to indicate what you were able to do, what you couldn't do, and even why you couldn't do it. Capture key what numbers. Let's say at a minister, you should be able to capture those numbers. Very, very important. How many vaccines and how many children were vaccinated? How many attendance did we get? You distributed what mosquito nets? How many were distributed? Which communities? So that we will not end up repeating the same thing. Probably you didn't indicate the same community. That will not help. Then once you do this work, you make sure that you share challenges that you are facing. Maybe the road is too quiet, and sometimes when you are doing home visit, you are scared. It's the challenge. You have to speak about it so that we see what we can do to improve that one. Any observations? Are there anything you think that needs to be reported, and what were you able to achieve? What were you able to do? Record them. Then again, within the same community, you should be able to yourself in a cheap compound. Then within 24 hours, you have about 8 children coming with diarrhea. Even if you are not so sure, you should be able to start making what? Sounding alarm. that no, this is unusual. Within the same maybe 1 month, you have a patient that attend, you should be able to what? Bring this information, because good reporting help facility to plan better. You within the community have been able to identify this. The moment you alert me or you alert people within the hospitals, they know that no, probably there is something, so that it can be what? Prevented, or we can stop the what? Spread. Let's move on to coordination. Volunteers must work hand in hand with community health nurses. This is what I just alluded to. Public health units, shape compounds, and mention that you asked, or was it Queen? If you go to a community and you have challenges, you find community leaders, the people who have influential are engaged in those communities. Get them to buy your idea and you are done. They will do the rest for you. Clear coordination, avoid overlaps, strengthen communication, and ensure everyone works under the same goal. It prevents this dual role, repetition of certain programs or activities, if we are able to communicate effectively. This also reminds me, or this is where I usually want to offer a word of caution to our hard-working volunteers. We are supporting partners. We are not clinicians. From where I come from, the moment we start talking about health today, tomorrow, the next day somebody will start ascribing certain role to you or giving you names. Oh, Madam Nurse, how you really living it? Don't go start prescribing. It is not doing your role. You enjoy the titles, it's good. That's okay. Please, don't allow it to get to your head. So when in doubt, the golden rule is what? Always refer. There are times people will come asking you questions. Sometimes they know what the answer is, but they will come asking you so many things. Just to test your understanding or try to know whether you're going to know whatever it is. As for this, I think it's about, please, let me introduce you to my supervisor. Madam, you've earned that respect by you referring her to somebody else, than you deciding to boldly face when you cannot. Be within your limits. Never go beyond it. All right. So as I said, we are support partners, not clinicians. But let's also not forget that there are some volunteers who will be working within certain programs that probably also have those skills or those skills. Yes, those, they can go ahead and do that. But this one, I'm referring to those of us who are the lower end, where our responsibilities are to recruit or to mobilize, direct, educate, to do that. So let's stay within our limits. Now, finally, let me look at some personal testimony I want to share. In fact, this is my group members, and It's good. Nobody saw me, so I don't think you'll be able to identify me in the group. That's nice. So, for me, growing up, I saw how simple acts of guiding a pregnant woman, helping what health talk, mobilizing households could change lives. Volunteering taught me leadership, empathy, and responsibility. It opened doors I never expected, and it gave me opportunity to work in communities, influence policy, and contribute to national programs. Every time I see a mother who understood the importance of AS because of a volunteer, or a child who immunization was completed because someone followed up, I am reminded that every contribution matters. Ladies and gentlemen, volunteers are not just helpers. We are educators, mobilizers, advocates, and the backbone of community health. Your contribution, no matter how small, lights the way for healthier community. Thank you, and may we all continue to serve with passion and purpose. Thank you very much.
Thank you so much for this wonderful insight on this workshop. So now the floor is open for any question and answer.